Kwanza takriban sasa nafikiri ni siku 116 hapo. Hadi hii leo bila ya kuchoka, bila ya kuonesha ulegevu, na wamewezesha wananchi wote kwa jumla kuelewa mambo ya corona. Kuna furaha kusema kwamba popote unapotembea kwa mchana au siku ya leo ni kwamba kila mmoja anaelewa mambo mawili ama matatu kuhusu corona. Na hiyo ni kwa sababu ya hawa waandishi wa habari kuweza kupasha wananchi wetu habari kuhusu corona, ili kuweza kuwapatia silaha ya kuweza kupigana kwa vita hivi. Kwa sababu vita hivi sio vita vya polisi, sio vita vya serikali kuu ama serikali ya county. Ni vita vyetu sisi wenyewe kama wananchi. Nadhani waziri ataongea kwa kina zaidi. Kwa yangu mimi ni kukaribisheni nyote, na pia kwa sasa hivi kuweza kumkaribisha ambaye ni mwenyeji wetu Deputy Governor Dr. Kingi, ili aweze kuongea machache na pia karibishe waziri.
Asante sana. The Minister for Health and your team, the County Secretary, County Commissioner of Mombasa, Kitio, I would like to express our utmost appreciation to the Ministry of Health and the national government for the support and cooperation we have received since the onset of the COVID pandemic. This is not to downplay our joint effort before the pandemic, but rather to show just how well our joint efforts have worked. All government agencies have put in their best to ensure we tackle the pandemic in the best way possible. I would also like to express our appreciation to the national administration team led by our County Commissioner Gilbert Kitio, who has worked extremely well with Governor Hassan Ali Joho of Mombasa to ensure all aspects of the COVID control measures are in place. As of early this month, Mombasa had recorded over 1,633 cases and 56 deaths. Over 24,000 tests have been carried out. Some 733 have successfully recovered, while a total of 811 have been admitted in hospital. We have progressed as per the Ministry of Health directive to manage some asymptomatic cases at home where the house conditions allow. Some 335 persons have been under home care. I would also like to thank the people of Mombasa for quickly adapting to the new order of life. Despite some challenges, we have worked together to manage the risk of infection even in the riskiest places like the Likoni Ferry and Kongowea Market. As we expand the house-based care program for some cases, there is need to activate and capacity build our community health volunteers to take on a lead role at community level. I hope the Ministry of Health will come up with strategies and tools to empower our CHVs to play a pivotal role. We have established a number of COVID response centers across the city. Our main hospital, the Coast General Teaching and Referral Hospital, is the main response and testing center. We have mobilized over 150 beds to deal with severe cases at the hospital. We have also mobilized some 300 beds at the local university, the Technical University of Mombasa, to deal with moderate cases of the disease. We have also dedicated 12 ICU beds, and we hope to mobilize up to 50 ICU beds in due course. We have ramped up our disease surveillance system by providing dedicated crews and ambulances to the COVID response teams. These teams are on call 24 hours to respond to COVID-related calls. The teams have also trained and equipped to safely deal with suspect cases. These measures have been undertaken in addition to the actions taken in conjunction with the national government to contain the spread of the illness. These measures include restrictions on social gatherings and imposition of social distance requirements in all public places. The measures came with closure of various businesses and limitation in many others. Tourism, which is a major employer in Mombasa, has been devastated. This has resulted in loss of jobs and business for many in the city. These jobs and businesses losses have piled to a lot of pressure on our already fragile economy, which was reeling from these investments in the cargo and logistics sector. The county government has been forced to take measures to support over 200 and our partners in the People's Republic of China for donating materials to our hospitals. We look forward to continued support and engagement with our ministry, even as we enter the challenging phase of reopening the economy. We are learning as we go along, and we hope to learn from you as well. We also hope to expand our capacities to combat future threats of this nature by learning from the lessons brought on by this pandemic. Thank you very much. I want to take this opportunity to now invite the CS for Health, Bwana Kagwe, to address the gathering. Thank you.
Thank you very much indeed, Your Excellency, the Deputy Governor. Fellow Kenyans, officials of the Mombasa County Government, residents of this beautiful county, and our friends from the Fourth Estate, a very good afternoon to you all. It is, for me, a great pleasure to be here, to be part of an ongoing countrywide assessment on the county-level preparedness on which we commenced a few weeks ago. I want to thank from the outset the Governor, the Deputy Governor, the CE for Health, Hazel Koitaba, and all other national, administrative, and county officers that are here with us today, including the co-chair of the National Emergency Response Committee on Coronavirus, as a county commissioner. Nilimuona hapo kidogo beleni. Yes, my friend. And all people who are here with us, who have done a tremendous amount of work and who have welcomed us so warmly. We are here not only because Mombasa County has recorded the second highest number of COVID-19 positive cases, but also because it has demonstrated that devolution can indeed be a success when the leaders are visionary and action-oriented. Reflecting on what Mombasa used to be and contrasting it with what it is today, one is inspired by the power of possibility. Indeed, I recall the first time I exited the Moi International Airport, Mombasa, only to find clean streets and buildings that had been merely painted with coastal colors of ocean and the sky. While to some, this may have seemed like a simple undertaking, to those of us who are used to a different, less glamorous welcome, it was uplifting, and it continues to be so. Today, as I join you in my capacity as Cabinet Secretary for Health, I view these changes in a different light. I now appreciate that those efforts were way above the whitewashing of residences and official buildings. They were symbolic of what Mombasa County and any other are capable of when their residents and leadership come together. Newness, cleanliness, order, and benefits that come with all that, including improved health care, particularly improved health care. We have noticed, as a result of the cleanliness, as a result of the hygiene measures, before and during COVID, the reduction of certain other diseases, such as common colds, etc., that have been reduced as a result of these cleanliness and hygiene measures. My fellow Kenyans, since we opened up the country by de-escalating the cessation of movements a few days ago, we have amplified our focus on county preparedness. As a ministry, we want to ensure that all counties have embraced this devolved task, not only as an obligation to their residents, but also as a sign of their commitment to them. Fellow Kenyans, county policies, their implementation, and the level of preparedness for your illness at a regular day, and more so during pandemic, are indicative of your leadership's interest in your well-being. Our aspiration for a devolved health system were informed as a nation by our zeal to improve the equitable access to innovative healthcare services and to avail these in an efficient, accountable, and transparent manner. Mombasa County is well on its way to achieving this and is so far setting the bar. Congratulations. Now that we all know that COVID-19 disease is going to be with us for a while, we need to put pressure on our county governments to prioritize health service delivery and to demand better services, the way it has been done here in Mombasa. If Mombasa can do it, it's well on its way that others can do it. As I mentioned before, we are now dealing with community infections, and it is important that every county must have the requisite medical facilities to be able to handle all conditions. County preparedness is critical to not only handling the pandemic, but also in ensuring that our country remains open. Therefore, in echoing His Excellency the President's appeal to county governors, I would like to beseech that those who have not reached the benchmark of 300 bed capacity as a minimum to please do so for the benefit of the residents of the respective counties. However, beds alone are not enough. Counties need to ensure that they have adequate staff manning their facilities and all protocols are properly observed. I'm glad to note that Mombasa County has already recruited the 52 additional healthcare workers under the Universal Healthcare Program to strengthen the human resource capacity. May I also say that even those counties that have not yet reported any cases remain at risk and therefore must not sit back but continue to prepare adequately. And I can report to you that the commitment we have seen from all governors across the country for this address to this disease has been absolutely impressive. While all counties are critical to our national well-being, as a hotspot for COVID-19 and a key hub for tourism and logistics, Mombasa is of particular interest because of its economic contribution to GDP. The impact that COVID-19 has had on Mombasa's economic activities, and especially the entire tourism sector, which is one of the country's main economic activities, has been monumental. And I sympathize, DG, with what you have said regarding the loss of jobs across Mombasa. And the sooner we can secure our health, the sooner we can secure and adhere to the measures that the Ministry of Health has given, the faster we can be able to bring back global tourism and we can recover the Mombasa economy. Mombasa County presently has over 1,663 active cases. And this number is likely to go up. Not to be a prophet of doom, but we also know that Mombasa is a place where everybody in Nairobi and elsewhere has been waiting to visit as soon as cessation of movement has been lifted. Now that it has, you can expect visitors from across the country and soon from overseas. Hopefully, this will not indicate, it will not mean that there is a surge of cases, but realistically, we can almost imagine that this is likely to happen. Mombasa, therefore, and I'm glad, DG, you have said it, must escalate the number of beds and so on, so that you can be able to handle the increased cases. This number of positive cases, that is the 1,663, has been extracted from a cumulative sample size of 24,000. From a statistical point of view, 138 people at the moment test positive from every 100,000 sample ran in Mombasa, while in Nairobi, with a caseload of 4,554, it is 100 for every 100,000 people, which means, in effect, that in terms of the intensity of the disease, Mombasa is ahead of the other counties. Fortunately for us, most of these people are fairly asymptomatic. And this explains the importance of having expanded capacity of isolation centers here in Mombasa and all other counties. As a government, we are pleased to note that Mombasa County has already achieved more than that. They are surpassing 432 and moving on ahead. Indeed, you are leading the country in the number of isolation beds, out of which 12 are ICU beds. These have been complemented with 10 ventilators. I really commend you and the government of Mombasa for your work. We are also pleased at the level of innovation you have embraced in repurposing the engineering department of the university into a fully fledged hospital in just a matter of months. Not years, just a matter of months. You repurposed that university into a hospital. And the need to provide, and you also created a special unit for patients with mental illness, perhaps the only county in Kenya that has done so. Because this is a category of patients that is often forgotten, and yet we know that they require much more attention compared to the rest of the patients. This wholesome approach to the provision of healthcare, even in times of pandemics and natural disasters, must form the core basis of our focus, even as we implement the recently released report by the Task Force on Mental Health? Well, as our tradition, I would like to update you on our coronavirus picture, and in doing so, begin by thanking our frontline health workers and volunteers for shielding us from the ravages of this virus. We continue to be indebted to you for the daily risks you take to try and protect us and keep us safe. I'm also very, very pleased here today, having been told by Daktari, the CEO of this hospital. Daktari, where is Daktari? Oh, you are here. Daktari, fantastic work. You are doing an excellent job. And your passion comes through. You know, we spoke on the phone the other day. I can't remember what the issue was, but there was something. You know, it couldn't have been we are exchanging pleasantries. But the passion with which you manage this institution, the care you have clearly for your staff and for your patients comes through when you are talking. And that is something. Congratulations. Please keep up the good work. It is not therefore strange that the first thing that he told me is that he wanted me to meet some patients on this side who have recovered in this hospital from COVID-19. And I want to thank God for you and thank God for your families and hope that, Daktari, next time we come, we can have a whole tent of people who have recovered from COVID-19. Thank you for your good work. And thank you to all the doctors, nurses, laboratory people, and technicians who made it possible. God works through people. It is God who healed you through these doctors. Today, we have recorded the largest number of positive cases since we first started reporting. Out of a sample of 3,803 tested over the last 24 hours, 447 people have tested positive. This now pushes our cumulative number of positive cases to nearly 9,000, standing at 8,975. The total number of tested samples to date have now gone over the 200,000 figure to 200,311. And from today's positive cases, Mombasa has an additional 14. This should not make us afraid, neither should it make us complacent. What we know is that if we take the measures that the Ministry of Health has told everybody, then we know that in spite of the many numbers, we are still going to be safe. We should not be complacent, and on the contrary, it should stir the Mombasa people to a higher level of vigilance, even though you only have 14. As for the gender distribution, the amazing thing still continues to be that we men are much, much more affected by this disease than our female sisters, mothers, and grandmothers. Today, for example, out of the figure that I have said, 282 positive cases are men, while 167 are women. While by age, we have a one-year-old infant who was tested positive, and an 88-year-old also. And the infant cases that we have been experiencing explain to us maybe why women are much more careful, particularly young mothers, those who have got kids that are breastfeeding. It is absolutely critical that you take measures to protect infants. These measures include ensuring that you have got your mask on, particularly if you are not certain about your status. It also means discouraging visitors from coming to the homes. It means discouraging people from our usual tradition where the village comes to greet a young infant. As soon as a young infant has arrived at home, we all know what we do. Kina mama wanajaa huko hiyo nyumba kumsalimia mgeni. Sisi tunaelewa hiyo ni Kiafrika. Lakini jameni, wakati huu wewe goja kidogo huyo mgeni apate nguvu kidogo, ndio sasa wewe uende ukatembee. Hata M-Pesa ni sawa. Tuma M-Pesa hiyo itoshe kwa wakati huu, kwa sababu we need to protect infants, and we are getting increasing numbers of infants, and that can only mean it is because of the practices that we usually have. And I would like us to appreciate that at this moment in time, it is difficult for us to continue with some of those practices. But I'm also delighted to inform you that we have also discharged 64 patients from our hospitals, bringing now the number of recoveries to 2,657. In Mombasa County, 738 people have recovered from the disease, and 335 are currently on home-based care. And I want again to congratulate the Mombasa County government and the Department of Health for the way they have embraced this issue of home care with a lot of zeal and a lot of efficiency and ability. Congratulations for doing so. I want to commend all the healthcare workers for the recoveries that we are experiencing and management of those who are now under the home care program. I am sad also to say that over those 24 hours, we have lost 4 more patients to the disease. Our total fatality is now 173, and my deepest condolences to all those who have lost their loved ones. In closing, I would like to remind our brethren in Mombasa one simple fact. If this virus was a physical enemy that came to attack you, we, the government, would have the capacity to protect you against it. If it was a physical enemy, if it was people who were attacking Mombasa, you would be sure that tanks would be roaring in the streets defending the people of Mombasa. We would send to you investigators, we would send to you the police to arrest any assailants that have posed a threat to you and your loved ones. But with COVID-19, the situation, unfortunately, is different. This enemy is an invisible one, and nobody in the government, not even the Minister for Health, not even the Governor of Mombasa, and for that matter, in his own words, not the President, can ensure that you are totally insulated from the disease. Only you can. Please remember that this virus has affected people in every village here in Mombasa and the entire country. Only you can avoid, only you can protect yourself, only you can isolate yourself as effectively as you can. Nobody else can. And you know, it's effort. It doesn't come easily. It doesn't just happen. It happens because you have exerted yourself to make sure that it is done. Mtakasha mvunguni chati afanye nini? Chati ainame. So I want to say to our brothers, kama hata wale wanashongaga, inaitwa kushonga miraa. Inaitwa nini? Wajua sisi watu ambara pengine Kiswahili chetu si kile sanifu kabisa, lakini ile ni kushonga, sio? Hiyo hata ukiwa unashonga miraa, tafadhali chukua kidogo, kaa mbali kidogo. Si lazima uwe kabisa karibu sana na yule mwingine. Si lazima, unaweza kaa kidogo na miraa itaingia tu vile vile, kawaida yake. Vile inaingia ukiwa karibu, ndio inaingia ukiwa bali kidogo. Hakuna tofauti. Kwa hivyo jameni, tafadhalini, ukiwa inaingia matatu, wewe angalia hiyo matatu iko namna gani. Ukiona imejaa, watu wanakaa kama sardines, usiingie hiyo gari. It's a choice. Kwa hivyo jameni, ukisikia watu wako usiku wanacheza muziki katika bar, na hiyo maneno Bwana Commissioner, unajua hivyo, the curfew is still on, and now that the police have got a bit of more time, you can be sure they are going to be very, very vigilant. So if I were you, I would not be out in the streets at 9 o'clock, particularly those who run entertainment centers, the bars. Tafadhalini, let's keep them closed. With the relaxation or some of the restrictions, the responsibility shifts to us. I can only plead that kwa sasa jameni, tujikinge na tukimbie sana kutoka kwa hii virusi. Na hiyo kukimbia kwake ni kufanya vile sisi tumesema. Na mimi nikiongea kama mzee, kwa sababu mimi sio kijana. Mimi nina watoto, nina mama, nina jirani. Na kwa sababu ingawa nina watoto wazima, mimi pia ni mtoto wa mtu. Si mimi pia ni mtoto wa mtu? Na ninaweza kumpelekea hata mama yangu, naweza kumpelekea hiyo virusi. Mimi naweza kufanya hivyo. Nikianza kumkimbilia bila kufikiria, bila kumchunga, bila mask. Na mimi jana nilisema hivi kutoka huku kule Makweni. Nikauliza wenzangu, wakati wewe ukitoka Mombasa unaenda kumtembelea mama, ukienda huko Ukambani ama Ingo ama Nyeri ama wapi, ukibeba mkate na mafuta na sukari, vile vile beba sanitizer na beba mask umpatie, kwa sababu yeye ni vizuri anakunywa chai, anakula chakula ambayo imepikwa na hiyo mafuta, walakini usipomsaidia, usipofanya vile wilaya ya afya inasema, basi hiyo yote itakuwa kupoteza wakati. Pendane.